We are live now, Doctor.
Good evening, everyone. On behalf of Team YOSI and Team YOSI Journal Club, we are here today to discuss a very important aspect in publishing, writing, and beyond. So the theme is to approach rejection in a pragmatic way. And before we start, YOSI Journal Club, the idea was the publish or perish, but we say it publish and cherish, a call to action. So this is the team under the guidance of our dynamic president, Devakant Mishra sir, for 2024 to 2026. And a good set of 20 executives who are also few are part of this webinar again today. So the idea is to cover a young ophthalmologist fellow, a postgraduate, be it first year, second year, or third year. And we started with this particular definition, though this is not for the IJO live wire, but predominantly we use the Mary format, and we devised it in such a way under the guidance of Sonal Kalia ma'am, as well as the previous team by Nupur ma'am, as well as Anujit. We had a presenter, a mentor, a research expert, followed by people who discuss on the positive, negative, and then to summarize on that particular article. So that is the MAARIE format that we were following. And this is the current team, myself along with Sonal ma'am, Niranjan, Anujit, as well as Ayushi. And this is a new format or slightly the different format that we are trying to continue from the previous team, along with the IJO live wire. So if any one of you is seeing this and you want to be part of it, you can always write to us. In this edition, we have 10 hot seat participants along with the 3 presenters who wanted to ask their doubts as well as clarify it to our chief guest, Vanati ma'am. So to share a few history of the Journal Club, this is how it started in 2021. You can see 4 capsule editions were done, then followed along with 2022, 2023. You can see the diverse natures of talks or rather articles that were dissected. And then came the IJO live wire, which started with biostatistics in last year, September, under the guidance of Vanati ma'am. We had our first pilot capsule of IJO live wire. And in 2024, we had 3 capsules of refractive retina and orbit, again, where we shared the articles priorly, the article of choice that was dissected. And we had 3 different versatile capsules. And along with that, we had the guidance of Vanati ma'am, where we had episode 1 was the case reports. Episode 2, we had photo essays, where we dissected how we should approach photo essays, all that we need to know. Third, we had the original articles. And then last capsule, we had the plagiarism avoidance thing that we need to do and mastering the reference management. It was more like a workshop where we had 3 dynamic speakers like today who shared their screen and showed how we need to avoid these things. And simple tips and tricks are there in the archive as well. And here we are today for this particular capsule, which is episode 5. And I would like to call upon our chief guest as well as ma'am for the guidance for the last 5 to 6 capsules, starting from the pilot last year. So Vanati ma'am is the present editor-in-chief and nominated council member of Afro-Asia Council of Ophthalmology and has held several positions in AOS as well as in other state forums. And she is graduated from the prestigious MMC and done a super specialization from AIMS. And she is the first woman editor of Indian Journal of Ophthalmology. It takes immense privilege to have you here, ma'am, for our 5th capsule. And a clinical expertise of corneal, cataract, and refractive surgery in medical and surgical corneas, especially in all types of keratoplasty and stem cell transplantation. So she's a compassionate teacher and a researcher and contributed in several international and national conferences with greater than 250 publications, greater than 80 chapters, as well as guided many postgraduates, undergraduates as books as well as presentations over 200. And to name some awards to name a few: winners of AIMS Research Excellence, Best of IJO, AOS IJO Silver Award, and the AOS KC Singhal Award, and many more to name a few. Thank you, ma'am, for being us. A few words from you before we go to the Devakant sir.
Thank you, Prasanna. And I think it is a wonderful journey which YOSI has embarked upon. And I'm sure it is benefiting a lot of the YOSI followers who are logging in or probably looking at these webinar sessions subsequently at leisure. And I really commend the team which chooses the topics and which puts up the platform for discussion. And I applaud your efforts, and I am always there to guide you and be along with you, come along with you, and walk along with you during the course of all your webinars. I'll be happy to do it. And it is my dream to see the next generation of ophthalmologists in India take India to greater heights in the international platform. And I would want all of you to equip yourselves with that much expertise and with that much knowledge and that much academics, so that you would keep India on top of all other nations in the coming years. All the best to all of you. And I'm really very happy to see the way YOSI is progressing forward.
Thank you, ma'am. A few words from our dynamic president, Devakant Mishra, sir, before we start the proceedings.
Thank you so much, Prasanna and team this IJO YOSI Livewire. And under the mentorship of Vanati ma'am, I mean, the quality of content that we are generating is really nice. And ma'am has said the golden words. I mean, we need to, progress and take Indian ophthalmology to another level. And research is one aspect that we feel that at times we do lag behind when we compare to other countries in terms of surgical volumes and surgical techniques. Numbers in general, we are doing great, but this is one area where we can really work upon. And hopefully, IJO YOSI Livewire will play a small, a big, at least some role it will play in taking this thing forward. So thank you, ma'am, for your mentorship, and thank you to the whole team for taking this forward in such a consistent manner. So over to you, Prasanna.
Thank you, sir. Without much delay, we'll go to the science part of it. So I and Dr. Niranjan will be moderating the session along with Dr. Ayushi from LVPI, and of course Anujit will be joining us shortly. So I would like to call upon Niranjan to is the screen visible, Niranjan?
Yes, sir. Yes, sir. Very much.
You can call upon the first speaker of the day.
Thank you, Prasanna, sir. So it is indeed my privilege to be a part of the fifth edition of our IJO YOSI Livewire, this wonderful collaboration between IJO and YOSI. And it is an honor to be a moderator for today's session to welcome our first speaker for the day, Dr. Nawazis, ma'am. And we are happy to have you with us again for the second time, ma'am. Last time, I think we had a session on the auspicious occasion of Eid. I remember you wishing all our viewers Eid Mubarak. So once again, welcome back. Very happy to have you with us today. So ma'am has completed her MBBS from Government Medical College, Maharashtra, Miraj, Maharashtra. And she's done her MD ophthalmology from the reputed RP Center, AIMS, New Delhi. And currently, she's working as a consultant ophthalmologist for empowering national healthcare programs with artificial intelligence by Ministry of Education. She's been awarded with the Best Junior and Senior Resident awards during her residency at the prestigious Dr. RPC AIMS. And she's also an assistant editor at the IJO since 2023 June. She has more than 30 PubMed Index articles and more than 10 chapters to her name. Over to you, ma'am, and we're looking forward to hear from you.
Are my slides visible?
Yeah.
Yes, ma'am. Now in full screen. Yes.
Okay. So basically, I'm going to talk about how to write a paper that gets published. But before we dive into this, we need to understand that we need a checklist prior to beginning the writing of a manuscript. This means that we need to ask ourselves some questions, whether we have done enough research on this topic or on my hypothesis, and whether my research is feasible, it is interesting, it is novel, ethical, and relevant for the times in which I'm planning to write the paper. For this, I need to first understand that there has to be a research gap that I have achieved at the end of my literature review to understand what am I going to write upon or what am I going to research upon. This could be done by doing an extensive literature review through either reading previous studies or through secondary data sources, as well as approaching our own mentors, seniors, and guides who could probably help us identify a research gap. So once I've identified the research gap, I've gotten my ethics approval, I've done my study, and it then comes the part of when I begin writing my manuscript. So at this time, I need to identify the journal of choice because different journals have different priorities, such as the Progress in Retinal and Eye Research accepts only invited review articles. Until a few years back, Survey of Ophthalmology also accepted articles only based on an outline, which would first be reviewed by the editors, and then they would be asked to proceed with writing a review article. Secondly, I need to identify the type of manuscript I want to write on, because again, the instruction to authors is different for a particular review article in different journals. So somewhere survey might accept an article which has 20,000 words, but IJO prefers articles which are less than 5,000 words. Similarly, it could be a perspective, it could be a commentary, it could be an original article. And so for that, I need to identify what is my manuscript of choice. Then I need to go through the instruction to authors because, again, specific word count for a specific journal. There is a specific reference style. So when I write for survey, I would have to make my references in alphabetical order, not chronological. Whereas when I talk about IJO, I would want it to be in chronological order, like not alphabetical, as well as the citation style that we require. So when we talk about a manuscript, it is divided into the IMRAD components, which is the introduction, the methods, the results, and the discussion mainly. Besides this, there are ancillary requirements in the form of tables, figures, and images, as well as the need of a title, an abstract, and a cover letter. So we'll cover each of them as and when we come to it. So, but before I talk about the others, let me just touch upon cover letter. So this is your pitch to the journal or the editor that why is your article covering an important aspect or a gap in literature for which you want it to be published in that journal. So basically you're selling yourself over here to the editor. Okay, hey, look, this is my article and this is why it needs to be published in your journal. So do give me the opportunity for the peer review. So this is how the flow of the paper goes. You have central 1, 2, or 3 ideas, which you cover through your introduction. You move towards the methods and define how you have covered them in your methods. Then move on to the results. Each idea, whatever you have planned your central theme to be, and then you give results accordingly to each idea. Similarly, with discussion, you cover upon all these points and then come to a conclusion. So I'm just going to begin with a small example of an original article, which basically initially the abstract is the miniature manuscript, which can be structured or unstructured. So when I talk about structured, I mean there is a purpose, a method, a result, and a conclusion part of it. Again, you need to stick to the word limits that are required by the journal. And whereas when I talk about an unstructured manuscript, unstructured abstract, it's basically, there is no purpose, methods, results, or conclusion. It's just a small, comprehensive miniature manuscript that you give to your readers, and which is the first thing a reader may read for your article to understand the gist of it. Secondly, when I move to introduction, it will provide the background to the central idea or ideas of your research, which will cover what is the research gap that you've identified for which you've done this study, and the rationale behind the study. And when we move on to methods, you need to at least ensure that these 9 points are covered. You need to ensure what is your study design. You need to give operational definitions. So for example, if it's an article for uveitis, I need to give the definitions of what I would call remission, of what I would call recurrence, and ensure that this is followed throughout the manuscript. I would have to give my sample size as well as sampling strategy. So if it's an epidemiological study, I would have to mention that cluster random sampling is being done or whatever I have followed. As well as if it's a study about a particular surgical procedure, I would have to describe it in detail about what the details of the surgical procedure are. Secondly, if I'm providing a new treatment, like for example, I am writing an article on basically use of biologicals in uveitis, and I'm describing a new biological that may be used as primary therapy. So I would have to detail what how I would initiate it, how I would carry it forward, and etc. Secondly, if it's a randomized control trial, I need to comment upon how the randomization was done, whether it was simple random sampling or if I used a computer-generated sequential number generation and then randomize my data. And finally, we need to talk about data management. This includes how I've collected the data and how do I plan to analyze this data. If there is any difference of how I'm going to do with continuous variables or and such. And finally, we need to talk about the human participant protection. So this is important. We need to ensure that our studies are ethical. We are not harming a patient in the process of doing our study. So this needs to be a part of your method. Then we move on to results. So here we're basically stating facts. This is what I've got in my research. We can present them in the form of text, tables, figures, or images. At this point, you're not interpreting or commenting on what your results are. You do not comment, it's basic fact stating over here. You state your facts and move on. This can be the briefest section of your paper also. Then when you move on to your discussion, this is the point where you can interpret or infer through your study. What do you think? What do you want to add to literature? An important section of this is the limitations of your study. You have to be frank. Whatever your strengths and limitations are, you have to include all of them. It's fine. A lot of studies may have at the same time strengths as well as limitations. So you have to be completely true to yourself and mention the limitations of your study. In discussion, you're not only summarizing the key results of your study, you can begin by a line or two to summarize the key results. You interpret and infer what was your result and how do you take it in line with the current literature. At the same time, some of us prefer comparing it with previous literature. So XYZ study said this is what has come out of my study. At this point, you would talk about the strengths of their study and the limitations of their study versus what were the strengths and limitations of your study and why is your study coming up with this. So you need to be able to explain and infer whatever your results are in this part of the manuscript. Finally, we have a small conclusion paragraph or some few lines about it, which provide the take-home message or the key finding at the end of your research. Again, at this point, we should know that throughout the manuscript, the central ideas that we have covered, we can only come to a conclusion based on those. So if we are doing a study that is covering one central idea, you cannot give a conclusion along another one. So it has to follow that central idea as your conclusion. Then some ancillary components would be your keywords. These are important because this is how indexing is done. This is how people will look for your paper. This is how you will get readership on your paper. More the readers, more the chances of you being cited in future. Then references. I think it has been covered last time, but I would again like to talk about references. This is important. A lot of us do not pay attention to our references and we submit articles to IJO, not conforming to the journal guidelines, and this delays the period that is required to technical check your publication as well as send it for peer review. So again, we need to pay attention to what the journal guidelines are to ensure that it goes to peer review as soon as possible. We can include images, tables, and figures. There are always a particular limit to the number of images, tables, or figures that are to be included in a manuscript. And they have to be original. You, under Creative Commons license, you may be able to quote it from a study, but you need to read about that from a particular journal's point of view, how to cite it, how to reuse an image, but preferably always make your own images, make your own tables, make your own figures. Try not to use anyone else's images or figures. And I'm just going to show you a small video of how we use references. So this is using Zotero. I have no financial disclosures, but Zotero has the option of us being able to download these various plugins in which you can make it alphabetical, you can make it Vancouver superscript, different from what is actually available in Zotero. And this is how you add in a citation wherever you need to apply. You will add it, press enter. When you need to make references, you go down, type references, and you add or edit your bibliography, and you have them all in the order in which you've preferred in your document. So this is just the last two slides. So why is a manuscript different from a thesis? A lot of times, a lot of people submit their papers in the form of how you've written a thesis. But a manuscript or a paper is different from your thesis or dissertation. So for a thesis to occur, you've created a protocol, you've submitted it to ethics, you've then compiled your entire thesis. But this is not how a manuscript works. The readership criteria for manuscripts is different. There is a word limit to it, whereas for a thesis, it's decided by your university how many words are required. You write it in much depth and detail when you're writing a thesis, whereas a manuscript has a limited number of words that you need to do. So you need to know that a manuscript is not equal to a dissertation, and you need to accordingly trim your thesis down so that it's in a presentable way to be submitted as a manuscript. Then when we talk about plagiarism, we need to ensure that there is no plagiarism in our original manuscripts, our review articles, or any of these. There are some freely available softwares such as Grammarly and Turnitin, whereas there are some subscription-based also, such as iAuthenticate, in which you can run your manuscript, find out if there is a particular level of plagiarism, and then paraphrase those areas to ensure that there is no plagiarism in this. The most recent of which is the use of AI for writing your manuscripts. So although generative AI may be allowed by some journals, you need to ensure that you're declaring its use. When I talk about generative AI, I mean that it can help you write the manuscript, but you need human oversight. At times, the AI may paraphrase your words in such a way that they sound authoritative, or they turn it in a different way, and that is not how you would want to express yourself to the journal. So again, there has to be human oversight, and you cannot list them as authors or co-authors. And whenever using AI, take it with a pinch of salt, try to paraphrase yourself better. Whenever at times there are journalists like Survey who have a dialogue box in which you're asked to submit the declaration right at the beginning of the manuscript, whether it uses AI or not. Similarly, hopefully in the future, IJO will be having something along similar lines. So take the use of AI for writing manuscripts with a pinch of salt. And that's about it. Thank you so much.
Thank you so much, ma'am, for the comprehensive, elaborate talk. Over to Vanati, madam, for her expert inputs. Ma'am.
I thank you, Navasish, and I do applaud her. I think she's unwell today, and she's just made herself fit to join us all and give her insights into this important topic. I mean, writing a manuscript is a little different from writing a thesis document. Whether you're writing for a master's degree or you're writing for your PhD degree is little different. And when you're writing it for publication in a journal, it's totally, because you have to sort of make it very concise into the word limits as required by the journal and follow the format of the journal. So for all of you who are beginning to write, I would really advise you at least once in a week or a fortnight, please pick up any journal which you would like to and go through a couple of articles. This is just to make your subconscious mind sort of register what is the format which is required for a particular journal. It's something like watching a movie or, watching an OTT show. It's just that familiarizing yourself with the requirements of a manuscript writing. And once you know this, you don't have to stress about and think, how should I go about writing? I think one of the questions on the chart pact is, do we follow IMRAD and our results are already there, our interpretations are already there. See, the way you write your thesis, you write with bulleted points, you write 1, 2, 3, 4, you write a summary, and then your inclusion, exclusion criteria. Several times I see my residents just copying it out from a PowerPoint presentation. Whereas for a journal, you would not want anything bulleted in points. You would want them in full formatted sentence in good English, in simple English with good grammar. That's all which we are looking for. And it's not that, right, my inclusion criteria are A, B, C, D. My exclusion criteria are, and then it's just a copy paste from your thesis manuscript. It should not be that way. You should always remember, when you're writing a manuscript, it's like writing a story. It's like writing a novel. It should be interesting for the person to read rather than feel that it is boring to read. And that is where your writing skills come in. Again, I would advise don't write your abstract first, write your introduction first, then go into your methodology, and then write down your results. So you might have your results in your thesis, and several times in thesis, the results are, just tables. You will just say the demographic characteristics of my patients are given in table 1. Then you will say the study parameters, the mean value of keratometry 1, keratometry 2 is given in table 2. That's not how you will have to write in your manuscript. You will have to write it in a way in which the reader is going to find it very exciting or very nice to read. And so that's why I say, please go back and read relevant. Suppose your article is on, say, for example, the outcomes of smile surgery with thin caps, or outcomes of smile surgery with 100 caps, 100 caps. Then go and read a couple of refractive articles which are related to you. So normally it would be there in your review of literature. But before starting to write, please go and read them again. And that will really give you an idea of how you will have to go about writing your methodology. Introduction should be very catchy. Your methodology is what everybody is going to be looking at. If your methodology is right and acceptable by the reviewer and the editorial board, is when they are going to move on to read the results and the discussion here. So if your methodology is flawed, then whatever be or how well written your discussion and results be, they will not be valid. So that's something which you need to understand, and it is very important. Several times I do find they write it's a prospective study, but everything else is being mentioned like a retrospective study. Please remember that editorial board members and reviewers are experienced people, and they will be able to pick out that you are falsifying your methodology of your research. So that's something which is very, very important you have to do. The crux is, you start writing after you're familiar and you have read at least a couple of articles for about 2 or 3 weeks in continuity, and that will, if you're a novice beginner, that will really help you to go about your writing nicely. And just to cover the other question about Institute Ethics Committee, every ethics committee, there's a local ethics committee, and there is a kilometer circumference beyond for which only the committee can cater to. So you cannot apply to an institute which is in your state or which is in your district, which is away from I think they have a kilometer average of, I'm not sure, about 10 or 15 kilometers is what it's going to cover. So you cannot apply to a particular your institutional ethics, and I don't think any institutional committee will do an external review. So that's something which you will have to know. And again, even if you're doing an observational study which is non-interventional, you will still need an ethics permission. If it's a prospective observational study, you will still need your ethics permissions, which means you will have to have your patient's consents forms and everything else signed here. If it's a retrospective study, you still need ethics permission, but probably you will not need all the permission forms, consent forms, because it's retrospective. Obviously, retrospective, you can't go and pull out your patients to sign the forms, but you will have the retrospective data, and your ethics committee will have to clear you. And again, in the ethics format, you actually will mention what's going to be your sample size, what is going to be your sample, your study sample, everything is mentioned. And if you say you're going to look at 100 patients' data, you are only obliged to look at 100 patients' data. You cannot look out 200 patients' data. Then you will have to get a modification from your ethics. So this is how strict actually when you apply ethics to your study is. And I know many people tend to flaunt this, but once you do learn to comply to this, you will know that your research is ethical and it will be of good value, and you will be able to produce statistical significance to what you are publishing.
Thank you, ma'am. Ma'am, another question that has been raised is CTRI registration mandatory for any kind of study, even if it's not a clinical trial, by one of our hot seat participants?
Yes. So anything when you're trying a new technique, when you're doing a new drug, so it is always going to require a clinical trial registry. It's always better to do it that way, because now I think most international journals also require you to give you a CTRI number. And that's when you can probably go and, like, if you are looking at NIH studies, you can even go online and see what are the studies which are ongoing. and what are the recruitments, and you could, look at ones which would be similar to, and you can take inputs and you can contact the authors of those studies to have a collaboration or and have an increased understanding. So I think a CTRI registration is the way to go forward. You need not get scared. It's something very simple to do. It's online and you can all do it very easily.
Hi, ma'am. Dr. Samhita. I'm the one who asked the doubt actually. My doubt was also that is this only for new techniques and drugs, or even any other kind of prospective study with data requires this? Not necessary, right? It's only for a new technique.
If you're looking at an observational data, then it is fine. But if you're looking at an interventional study, then you will need a CTRI. Yeah.
Okay. Right. Thank you.
Ma'am, I think it's a great participation, ma'am. We have had more than 10 questions in the chat box. The topic really, as Madam, under your guidance, I think this has really created a lot of interest among our young ophthalmologists as well. And Nawazish, Dr. Nawazish, thank you for this wonderful talk. I had the privilege to listen to you recently as well in Niscaris. The slide speaks for itself with great videos as well as a workshop kind of a manner. So before we move to the next speaker, ma'am, one quick tip of advice, maybe Dr. Nawazish can also take it. Another last question is for aspiring independent consultants. Another big issue is approach to statisticians. I mean, how can we get help? So is there any other guidance that we can give for young ophthalmologists who don't have a statistician in-house? Any tips or tricks, ma'am or Dr. Nawazish?
Nawazish, the question is for you. Yeah.
So there are available courses that we can go through, which will give us basics into statistics, as well as advanced courses available that could teach you how to use data. They're not very difficult to do, or you can always approach your medical college in which you've done from. There are always statisticians available over there. You can ask them for help. They normally never say no. But I would personally say that their courses are not very difficult. There's the basic course in biomedical research available. You can do that, and then go for an advanced course, which tells you it covers all your requirements. So they are available online once weekly courses. So you can just cover them up like this way, or approach a medical college in which you've been attached or with which you passed from an alumnus for. They usually help with all of these things. Ma'am, have I missed something in this?
Yeah, no, that's absolutely right, Nawazish. And a word of advice which I would give for you is that all of you should know some amount of basic statistics. So that's when, as Nawazish advised, if you want to revise your statistics knowledge, do take you could read some of the basic books, or to take an online course which would help you to walk you through it here. And there are independent statisticians whom you can hire or whom you can reach out to, and there are paid statisticians who would help you for your analysis. But remember, unless you know what statistics is perhaps going to be applicable, sometimes you will not be able to, really explain what you need from them, or able to interpret what they are telling you. And it's not that all statisticians are going to be doing things right. They might have another perspective to it. So unless you know your subject well enough, and you also know some amount of basic research statistics, you might land up doing a statistic analysis which might not be approved by your reviewers. And they will pull out a lot of questions, and your study might get rejected based on a statistical flaw in the methodology.
Thank you. Thank you, ma'am. And thanks to all the hot seat participants for keeping the discussion very vibrant. So with that, we'll move to the next speaker. So next we have Dr. Ashish Markan. So Dr. Ashish Markan is one of our executives in YOSI, and he's an accomplished VR surgeon and UVR specialist, currently working at I7 Hospital. And you can see his qualification. I think the only thing is FRCO is missing, I suppose. So a very dynamic academician, and 50 plus scientific publications. He is supported by many prestigious international travel grants. In addition to his clinical and academic roles, he is also a social media influencer with 66,000 followers. And he has also won the recent YO Influencer of the Year award at APAO Bali and YOSICon 2024. So he's very actively engaged in media education and especially through social media. The other words, as of course, the handle is at your_retina_doctor at Instagram. And his other achievements and awards: IJO Silver Award in 2020, Gold Medal for FICO UVA, more than 10 awards in several national and international conferences, and the best paper presentation at Bridge Retina Congress 2024, Alexandria, Egypt, to name a few, along with his International Hero Award at AOS 2023. Over to you, Dr. Ashish, to talk about approaching the rejections pragmatically and positively, and how to convert it in a very scientific manner by revisions.
Yeah, thank you so much, Prasanna, for that kind introduction. Good evening, everyone. So we all know that writing a manuscript and then getting it published is basically a daunting task. We need to face a lot of rejection, and then we have to reply to a number of reviewer comments. So you see, this journey is very tedious. We need to be patient, and we must remember that it's not over till it's over. So whenever you get your work published in a peer-reviewed journal, it not only adds to your academic and a career advancement, but it also increases your credibility amongst your peers. Also, once your work is being published, it adds to the science. So whenever you send a manuscript for publication in a journal, you must remember that the answer you should be waiting for is not that congratulations, your paper is being accepted. Rather, it should be something on lines of, we think that there is a value in your manuscript and we invite you to resubmit a revised version addressing the following comments. I think all of us would agree to this, that hardly any manuscript would get published or would get accepted on its first submission. So whenever you receive these reviewer comments, just remember that a number of scholars with valuable expertise, they have looked into your paper, they have spent their time, they've read your manuscript, and that their comments would help you to further improve your paper. So let us just look at what the peer review process actually is. So you've written a manuscript, now you have submitted it to a journal. So it will be assessed by the editor of the journal. So if the editor feels that the manuscript is not suitable for the journal, it will be outrightly rejected. And if there's some value in your paper, the editor would pass it on to the reviewers, which is known as the peer review process. So the peer reviews would read your paper, they would either reject it, they would accept it, or they may ask for some revisions. So this could be a major revision, could be a minor revision. And they expect that you make these changes in the manuscript and then you resubmit it to the editor again. So the peer review process could be single-blinded, could be double-blinded, could be triple-blinded. It could be an open peer review, could be a collaborative review, or could be a third-party review. So you see, now once the peer review has been done, your paper has gone through the peer review process. Now you will receive a response from a journal. So you can either get an email saying that your manuscript is being rejected, which could either be a desk rejection or it could be a rejection following reviewer comments. Or you can get a mail which says that your manuscript is accepted subject to major revisions. It could be accepted with minor revisions, or rarely you can get a mail which says accept with no revisions. And if you get such a mail which says accept with no revisions, I would say that is an occasion to pop a bottle of champagne. So this is something which we all face, that you send a manuscript and within few days you get a rejection mail directly from the editor. So you see, this is something which is known as desk rejection. So desk rejection is a quick decision by the editorial staff of a journal to not forward a manuscript for review. So there are primarily two reasons. One is because the journal is getting so many manuscripts and the number of reviewers are so less. So the editor basically wants to conserve the journal's resources. And second is because the editor feels that your manuscript is not suitable for publication and does not want to waste your time. And so he wants the authors to move on and then find a more suitable place to publish it. Data suggests that highly selective journals reportedly desk reject as many as 88% of manuscripts they receive. So what are the reasons for desk rejection? First is your manuscript is not a good fit. Second, the manuscript is not the right length. Thirdly, the manuscript is not ready for publication. And lastly, the manuscript is not convincing. So you must see that there is a huge difference between writing because you have something to say and writing because you have to say something. So the latter kind of writing, which is that you're writing because you have to say something, is much likelier to be desk rejected. So what can you do to make your manuscript better? First, you should read the aims and scope information of the potential journals. If you're unsure about a paper, you could contact the journal editors and ask for advice. Not all of them will answer, but you have nothing to lose. Second, looking at the length, you must make sure that you find the recommended word count. Make sure you understand what this number actually means, whether it also includes the references, whether it also includes the appendices or not. Thirdly, if you feel that manuscript is not ready for publication, make sure you get a feedback from a peer or an experienced mentor before you submit. Read the author guidelines very carefully and proofread your work carefully. Now, lastly, it is the author's responsibility to convince the editor that their manuscript is worth submitting and worth publishing. So you must convey a message, what is new and important about your research. There are 3 places where you should do this. First, at the cover letter, second, in the abstract, and third, in the article itself, especially in the introduction and in the conclusion. So this is what we've already talked about. So there is 2 types of rejection. One is the outright rejection or the desk rejection. So if you get this article desk rejected, you should incorporate the editorial and reviewer comments if you have received any, and then try to submit it to a more appropriate journal. And if you get the reviewer comments, then we must learn how to respond to a reviewer comment. So you see what to do once you receive a review. First, take a deep breath, reread and consider all the comments, consult your co-authors, assess the overall feedback, identify the major concerns, think and form a response before starting to write it. So you see, you have to follow few principles when you start to respond to the reviewer comments. You have to be polite, you have to be humble. You have to acknowledge and accept the changes you agree with. In case you disagree, you can put forward your point of view, but in a more politer way. And you have to address all the comments point by point and make revisions accordingly. So you have to thank the reviewers for their time and effort, include acknowledgement in both opening and the closing statements, and do not take negative feedback personally. So this is something we must discuss what is a good example, a bad example whenever you're replying to the reviewer. So you see, writing something like, we would like to thank the reviewer for the interest on this topic is something, a good example, right? But if you say something like, I do not think the reviewer understand my point of view, that is a bad example. That is a rude way of replying to the reviewers. The reviewer has correctly pointed out that. So this is a good thing. This is the way you should actually write it, rather than saying it would not be necessary to change according to the reviewer's suggestions because. So you need to respect that reviewers are given their time in your manuscript, and you have to acknowledge the fact that they are the experts in that field and they have given time. So basically you need to acknowledge and accept if there are any factual errors, there are missing references, there are some grammatical errors, or there is some missing tables or figure legends. They need to be corrected right away. You have to be open to the reviewer ideas and point of view. You must understand that if the reviewer does not understand your point, readers won't understand it either. So you should identify and incorporate the suggestions which will enrich your paper. Also, you have all the right to defend your ideas, but in a polite way. You can always add tables, figures, citations to defend your ideas. And if you cannot address a point, you should give a reason. So you see, whenever you get peer review comments, they could be the easy ones, or we call them the minor revision, which means you need to rephrase a sentence or rephrase a paragraph. You need to add some extra references, extra tables or figures. You might have to add an appendix. You might have to add an extra paragraph. But there could be these difficult comments, or we call them the major revision, where the reviewer wants you to modify your central hypothesis, wants to redo an experiment or some statistical test, or they might even want to modify your methodology. So you see, you have to respond to each reviewer comment separately, respond to each comment separately, and you need to mention the page and the line number of each correction or the addition which you have made. So this is a 2 out of 7 page reply, which I drafted a couple of years back. So you see, basically the reply has to be very extensive. You need to individually thank the editor, thank the reviewer, and then you need to copy paste the reviewer comments in one section of the table. Then whatever changes you have made, you write them in the next column, and then you also mention the page number, the line number. So this entire thing took me a month, but then it was worth the time and the effort, because this paper got actually published in Therapeutic Advances in Ophthalmology, and it is one of the best read papers, or the most cited paper for imaging biomarkers in diabetic retinopathy and diabetic macular edema. And lastly, whenever you're writing the letter, you need to conclude in a very appropriate way. Now, writing something like, since all the corrections have been made, we hope the manuscript will now be accepted without any further changes. Definitely, this is very rude. You cannot write something like this. But writing something like, we look forward to hearing from you regarding our submission. We would be glad to respond to any further questions and comments that you may have. Such an ending is formal, polite, and reflects a willingness to make further changes if required. And lastly, what not to do. You must not complain to the program chairs or the editors. You must not post the reviews online. You should never write an angry letter, must not discard the reviews which have been given by the reviewer, and should not give up on your manuscript. So the take-home message is that whenever your manuscript gets rejected or you get some reviewer comments, that does not mean that your paper or your manuscript is not worth publishing. That just means that it requires some changes. And once you make these changes, that would make your publication or your manuscript scientifically robust, and the chances of getting it published increases manifold. Thank you.
Thank you, Dr. Ashish. It was wonderful. Thank you for sharing your insights and especially the wonderful response to reviewer comments letter. We have a couple of questions. Dr. Vanati, ma'am, would you like to comment first before we go on to the questions?
If we get a desk rejection, is it advisable to make changes and send the same to the same journal again, or totally go to a different journal? Okay. So for example, there is an article which talks about messenger RNA changes in, say, an animal study looking at a particular aspect of, say, diabetic retinopathy. And this is a hardcore experimental study. And IJO is a clinical journal here. And it would probably take a small element of experimental study, but it is not an experimental journal. And if such an article gets submitted with IJO, then I would not even forward it to my associate editors or section editors. I would look at it and I would say, I'm so I'll be very polite to them. I will not say them, thank you for submitting, but I think we would not be considering it further, and it would be more suitable for a journal in experimental ophthalmology. Okay, so you really will have to understand if the journal you're submitting to has the target audience for the subject which you're discussing in your manuscript. That's going to be very important here. For example, if you're talking about a very closed niche of a vitreoretinal surgical technique, and if you are going to submit it to Indian Journal of Ophthalmology, which is largely a general ophthalmology, or it is subspecialty to probably an intermediate level, a mild or an intermediate level, but something which is really hardcore and is going to be appreciated only by very experienced vitreoretinal surgeons, then the reviewer probably would say this is better taken up in a niche journal than being taken up in a hardcore. It's something like if I'm going to discuss very fine aspects of select technique, then I would rather consider submitting it to Ocular Surface rather than submitting it to Indian Journal of Ophthalmology. I do know when such a technique comes to Indian Journal of Ophthalmology, it has already been rejected by Ocular Surface. Okay, so people do look at IJO always as a second rung once their subspecialty or their specialty ones have been refused from cornea or has been refused from Ocular Surface. And that's very obvious to the editorial team that this has come here because then we already know that there's something lacking in your study because of which it didn't go into something. And I think the best person who knows the downsides of one study is the author himself or herself. When I write my paper, I know what are the points lacking in the methodology here. I know how I could have better done this study. And I would probably know, why mine is not getting accepted in survey ophthalmology, why mine is not going through IJO, why probably my statistical strength is not to the expected limit of what ophthalmology is looking at. So as an author, you obviously know what your thing is lacking, but you would still want to pressurize your journal's team to accept what you have. And if the journal's team finds it beyond what is acceptable according to their publishing policy, then they are free to reject it. So a rejection always does not mean that your article was not good enough, but it is lacking. And the lacunae is probably not acceptable according to the publication ethics or the publication policy of the journal. That's something which you need to. So then you will probably, if you find everything else is okay, then you probably will have to step it down to another level of journal. So that would then generally go to a journal whose citation index or the impact factor is lesser than that of the journal which you approached. So that's how you would move down according to, because you definitely know what is lacking. And that's why it's a nice policy to discuss these aspects or lacunae of your study or the drawbacks of your study in the discussion itself and explain to the reviewer why you were not able to do this. And if the reviewer finds it acceptable, he or she is willingly going to accept this and say the author has already discussed these points. So for the reader, he is going to be absorbing the content of or the knowledge provided by this manuscript along with these limitations. So that's how you go about expressing that, right? I hope that answers your question. Yeah.
Yes, thank you.
Dr. Sahil is asking that sometimes we do get comments from reviewer that this study is lacking something major or should have included something. So he's asking that how do you handle this? Like, can we go back and should we do a new study or
Yes.
what?
See, for example, let me quote something very new that you're looking at intraocular pressure evaluation in patients who have undergone refractive surgery, and all of us know there are numerous studies which have already been done on this particular subject, and we all know that the intraocular pressure, once the corneal pachymetry is altered, is going to be varied, and there are various correction factors which are already described. Now, if my thesis mentor gave me a similar topic, okay, the first thing if I'm the thesis candidate, the first thing, that's what review of literature really means, that you sit back and search in literature what has already been done. Then you should be, smart enough to go and ask your mentor, sir or ma'am, this study has already been done. Why am I doing it all over again? And if I've done this study and I've done this thesis manuscript, and if I'm going to submit it to IJO, I'm definitely going to say there are 100 studies which are talking about alteration in intraocular pressure following refractive surgery. What is the novelty which you're presenting in your study? And obviously, you cannot go back and introduce novelty once your study is already done. So that's when as a student, I think all of us go to do thesis after we have cleared our MBBS, which means we are, MBBS is 6 years. It's 5.5 years. So if at the same age you've done an administrative course and you've become a collector, you'll be running a district. I say this to my residents all, okay? And you cannot say, oh, I didn't know this. You're supposed to know this when you're running a district as a collector. The same thing applies when you sit to do a post-graduation. Stop looking for blackboard teaching. You will have to use your intellect because you are a doctor yourself, and you will have to raise your intellect levels, and your mentor or guide is only going to be a mentor or guide and is not going to be doing textbook teaching or blackboard teaching as in kindergarten. So you had an opportunity to look at your review of literature and question your mentor, why am I doing this when I'm not going to find anything new over what? So this is what is the process of learning to do a research. Again, when you look at your methodology, that's when you need to have a little knowledge about statistics so that you will know that, is my methodology adequate enough? For example, say I'm looking at a new medication in fungal keratitis. And I'm going to just say, okay, I will do it in 33 patients only. Okay, because we all know when you do 35, it has a statistical relevance. But for example, of the 35 patients, 15 were Aspergillus. And Aspergillus had at least 3 or 4 common genotypes. And out of the 15, you have 2 Aspergillus niger, you have 3 of the other type of Aspergillus, and you have 4 of a Fusarium solani, you have something else. What statistical relevance will you get out of your 35 patients? And what statistical conclusion can you have from your study? And when you submit that for cornea, it's outright going to get rejected. You know that, and that's why you come to IJO, because IJO has a lower impact factor. But then if I am going to be looking at, I'm also going to ask the same question. So you'll have to remember, thesis is well done or a research is well done at the protocol stage or at the stage when the planning happens. And the reviewer's job is to find out faults or be critical, constructively critical of what's written. So if something is really lacking a huge point, then it cannot be accepted. Then you either go back and look at those points, if those have already been done and you're able to do your statistics and you're able to do a little, you're able to take out those data again and search it out. If you have the data, if you don't have the data, then you'll have to tell them, I don't have the data. And it will be up to the reviewer board who will consider whether it's valid enough to accept your paper for publication, given these lacunae. That's when they will then, I would probably, if I want to give them a mercy chance, tell them, okay, convert it into a letter to editor. Because the strength of a letter to editor is not as good as an original article. We all know that a letter to editor is just, probably narrating some hypothesis, or just, you've just tested it out and you've seen it enough, so you want to share a new idea which you think, but it is not probably statistically supported, or it's not supported with the adequate strength which needs in terms of methodology and interpretations. That's how you need to look at every rejection and every comment. And you should remember, the bottom line is, why would any editor not want to have the best of papers in his or her journal? Because that's my business of publishing the best and wanting my impact factor to rise and give better citation for you, for the authors, and that's the business in which I am in. Why would I not want it? And there are no personal biases in this at all.
Thank you, ma'am. There is one more similar question by Dr. Arshi, that what if we get a major review with no guarantee of acceptance? Would you, how can we avoid
What if
this?
we get a major revision needed with no guarantee of acceptance? What to do next? Which means there is a major fault in the way the paper has been written. There's something which is not acceptable to the editorial board, and instead of giving an outright rejection, they're giving you a chance to rectify the faults of your paper. Because several times if I reject outright, because I'm acceptable to everybody in India. India is a huge country with a number of ophthalmologists, and I would like to really, people do say, if we can't publish in IJO, then what happens? But then you will all, when you are auditing my performance, you're going to say, how did you contribute to rise, to improve the impact factor of the journal? So if I keep publishing things which are already published in other journals, our impact factor is never going to increase, isn't it? And that's the primary duty, where I'm going to increase the face value of Indian academics in the international world of research, right? So when I find that the writing is very poor, or it's probably a repetition, a major review is a repetition of what is already published, instead of giving it an outright chance, I'm probably letting them understand, see, these are all the drawbacks or the concerns in your particular journal. And several times when you say no guarantee, it's because, say, if 3 reviewers have reviewed a paper, at least 2 or all 3 of them have said reject. Every reviewer, once they've given the review, they also give their final recommendation saying, I would like to see this revised. I want a minor revision, or they would outright say reject. But it's the editor who probably assesses it and says, okay, let me give them one more chance to see if, this person can correct all this. And then I could probably put it forward for a second review to see if it's acceptable. That's how it works. And probably that's how you all will work if you are also sitting on the same seat I'm sitting in.
Thank you, ma'am. Dr. Prasanna, should we take up one more question before we move on to our next dynamic speaker?
Yeah, ma'am, in the continuation to the previous talk, even if Dr. Nawazish or Dr. Ashish is available, they can also take this talk, and ma'am can help moderate it. So we did have one question of one of the private practitioners asking, how should we set up our ethical committee? Is there any courses or any workshops that they need to undergo to know how to set up their own ethics committee?
Go to your state and your district ophthalmological society. It's their job to do it. There's an editor everywhere there. So that's what, state committees are supposed to be doing, and state journal, state office bearers are supposed to be doing. They need to be knowledgeable. It's not, you become an office bearer of a journal without knowing of a state, without knowing, that's not done. I think you need to lift yourself and your responsibility levels and your knowledge levels to the positions and what the positions demand out of you. So I think they will all have to learn to set up, and every district ophthalmic society, every state ophthalmic society can really help on that.
Ma'am, in continuation with this, can a person also approach any hospital or any other institute having an ethical committee?
There is a local kilometer. I said there's a circumference for which every ethical committee can work.
Okay.
So that's one of the norms. So then, if the few people who are in that will have, so your district societies have a role to play in this.
Yes.
And I think there is you all know what an ethics committee needs to be comprised of. And so it needs to be formed so that, all these people are knowledgeable enough to evaluate the submissions which are coming to them. And it will have people from different walks of life in that particular committee, including statisticians, including public figures, and including academics, lawyers, and all. So all these people are, are knowledgeable ones who will be, and of course you will have ophthalmologists also. So they will all be knowledgeable to evaluate your your submission. So it would partly be the responsibility of the district society to have one committee formed if you have a lot of local practitioners who want an ethics committee to be formed. Yeah, and just to add on to what Arshi had asked on no guarantee. So this has been particularly added on because there are several authors who come back and get into a negative discussion with the editorial board that's saying, I had 2 revisions and you have rejected my article. Please remember, journals such as British Journal of Ophthalmology, American Journal of Ophthalmology, Cornea, it has happened with me as well. I might have done as much as 3 revisions and it still gets rejected. So it is not mandatory that the number of revisions is going to guarantee your acceptance. That's something, it's only that probably they are still looking for something and they're seeing if you're able to really, give that to them. And if it is not satisfactory, it is well within the rights and the purview of the editorial board to reject your manuscript. And that's something which everybody, it's something like running a race. You can't win every time. You have to be sportive enough to, the participation is what that matters. You can win or lose, but the spirit of participation always needs to be held in a positive spirit.
Ma'am, I have one question. Do you always send the article back to the same reviewers, or do you also send it to some other reviewers when the article is being submitted the second time?
It will depend on how the editor is. If you're asking me, but I'm going to answer in general.
In general, how
yeah.
is it decided that?
Okay, see, for example, there was a major original article, something new which came in. Then the editor decides whether it has to be reviewed by 3 people or 5 people, depending upon the strength of subject and the novelty of the subject. And of the 5, 3 might reject and 2 might accept. Or 3 might accept and 2 might reject. And they would also, there are columns for editors' comments, for reviewers' comments to the editors as well. And in those, they will also say, I don't want to review the revision. Every reviewer, I think if you people have all reviewed for other journals, there is a column where you are asked whether you would want to review the revision as well. And it's up to the discretion of the reviewer to say whether they want to review the revision. And when they have opined that they do not want to, and then it depends on the number of, so there are 5 people, and if they said 4 will review it, then I don't, if the 5th has refused, the 4 is well enough for me to know. But then of the 5, if 4 have refused and only 1 is going to review, then I would call for new reviewers. And again, remember, when new reviewers are coming in, they are probably going to raise new points. That's when it goes for a next revision then. So that's how you learn. Yeah.
So I basically asked this question because we submitted a paper in ophthalmology retina and we received very positive reviewer comments. And we were very hopeful that the paper will be accepted. But once we submitted the reviewer comments, maybe in next 5-10 days, we received the mail from the editor that the manuscript is not suitable for
several
publication.
times, most of us are very polite. We do not translate. See, the way reviewers, the language which reviewers write to us is totally different from the language they use to write to the authors. So they might write everything sugar-coated to the authors, but they will write the bare truth to us, which we will not reveal to the authors at all. And that's how it is. So for you, they might, and especially Western journals will really write very polite English. I'm so happy that you looked at this work and this is a wonderful compilation. But to the editor, they write, this is not worth considering at all. So the author will go back thinking, oh, I've got such beautiful comments, mine is going to be accepted. So never get, taken away by what the reviewers are writing to you. Yeah.
Thank you.
Thank you, ma'am. We'll take the rest of the questions after our last talk by our very dynamic speaker, Dr. Bhavik. Dr. Prasanna, are you sharing the slides? Yeah, thank you. So Dr. Bhavik is a vitreoretina and uvea consultant at L.V. Prasad Eye Institute, Vizag, where he has also served as the head of the campus. He has done his fellowship from L.V. Prasad Eye Institute, Hyderabad, in vitreoretina and uveitis services, and has over 50 articles in PubMed indexed journals. He has several awards and honors to his name. The list is endless, actually. And he has also served as the executive member of YOSI and also a part of the leadership development program at the Asia Pacific Vitreoretina Society. Over to you, Dr. Bhavik.
Yeah, first of all, thank you, YOSI, and for this initiative Uh, I've been following you guys and was part of the second talk as well. And a wonderful series. Thank you, Dr. Vanati as well and Prasanna. And thank you, Ayushi, for this wonderful comments. So my talk will be in continuation of what the previous speakers have spoken of. There might be some overlap as well to an extent. Fine. So is my screen visible now?
Yes, sir.
Yeah. Okay. So the talk is about turning rejection into acceptance in academic publishing. Right. So what Ashish just spoke on, I'm just going to continue on how to ensure that once you get a rejection, how you deal with it. Right. So as I mentioned, a lot of points would be going about what was discussed. Maybe it's like a revision for the listeners, for the viewers here. So the first most important point here is understand the reviewer feedback. As just now Dr. Vanati explained about, it might be sugar coated, or sometimes the reviewer might be actually, see, they are also humans, right? They understand that when we also review, we see that, okay, this is a young researcher, he's just a first year resident or just a young faculty. Let us guide them. So the reviewers sometimes are kind enough to actually guide you. Sometimes they can edit your entire manuscript as well. Okay, so analyze the feedback from your reviewers, differentiate between major and minor issues, request clarification if the feedback is unclear from them, focus on improving clarity in presentation of research. So what I'm trying to say here is, let us look at the example. So manuscript on the novel surgical technique for treating retinal detachment was rejected. Okay. The reviewer cited a lack of sufficient patient follow-up data. So the reviewer here is trying to help the individual, the group as well, and get the follow-up data. Again, you submit this. Okay. So the authors conducted additional follow-ups, reanalyzed long-term outcomes, and resubmitted the improved version, and then it was accepted. So I'll share my own example. Many years ago, one of the reviewers, I don't know his name or her name, actually went out of his turn, improved my language, improved. Actually, he edited almost the entire manuscript for me and sent it to me. Okay, so that is extremely kind of that individual, and this kindness helps. Like if I have to review, I'll ensure that okay, this person gains out of my review as well. The next point here is embrace the learning opportunity. Okay, so rejections often point to waste or to strengthen the manuscript. So don't take it as in a negative way. Okay, it's just going to build up your paper into much better way. Okay, reviewers' comments help improve the clarity, methodology, or data presentation. Treat feedback as a way to advance the paper's quality, not a reflection on its merit. Okay, simple example, when Lal Singh Chadda was the movie which was projected to certain people, they rejected it. They didn't like it, the reviewers, or I'll say the people who saw the trailer. But the feedback was not taken, and we know that it was a flop movie. Same way here, another example here, a study on a new drug's efficacy in treating diabetic macular edema was rejected because the control group was not clearly defined. Okay, but in this case, the authors listened to them. Okay, refined the manuscript, clearly described the control group, and explained how it was chosen. And this feedback was a learning moment for them, and it was eventually accepted. So this gives an opportunity to revise and strengthen your manuscript. Address every point raised, whether major or minor. Improve the data presentation, figures, or analysis. Ensure that the manuscript fits the scope and aims of the journal. Okay. I think I'll say this is my own example here. No, not this one. So this was about a clinical research paper on intravenous injections. So reviewers wanted much more clearer visual data. Okay, and the figures were not adequately supporting the claims. That happens. You read it, you realize there's no raw data available and all. Okay, so you can always ask for the raw data once paper is published. But as a reviewer, you can also ask for the additional information to be published so that your data is much more strengthened and your paper is much more robust. Right. The fourth point is the resubmission strategy. This is the most important point here. For the same journal, you can write a detailed rebuttal letter. Rebuttal is not always in the bad way, it can be in the good way as well. Explain clearly how each concern was addressed. And for a different journal, ensure that the paper is aligned with the new journal's focus. Okay, this was my own example. We had a paper on managing subhyaloid hemorrhage with Nd:YAG laser, rejected due to lack of clarity in statistical analysis. So nothing, we sat back with our statistician, explain the rationale for the methods. Okay, and upon resubmission to the same journal, it was accepted. Right. So what is important is to decide what to change. So I'm going to give you 7 tips on deciding what to change. So you must address all the comments. Okay, whatever comments are given, either good, bad. It is, if the comment is it was a good manuscript, you should always address thank you. You can't pick and choose which ones to address. Even minor comments need to be addressed. Second important point here is address does not mean always that you have to change anything. Your team should decide what to change and what to defend. Often changing is the easiest rather than defending, but that depends on the situation. Okay, the next point here is change also does not always mean to revamp. Okay, easy changes include rewording, adding extra references, adding extra paragraph, table, figure, appendix. Okay, more difficult changes include modifying your central hypothesis, redoing an experiment. These are the difficult changes. Okay, always change technical errors because even minor errors can cast doubts in the reviewers as well as the readers as well. Always change errors and references. See, skilled reviewers, they know everything. They know their papers, they know their data. Okay, they know their literature. They know from which paragraph this line has been taken and all. You don't want to get off on the wrong foot with such experts. Okay. This I think is the most important point. When a reviewer writes, I did not understand type comments, right? I don't understand this paragraph. Best is to delete it, to change it, rather than trying to explain it, justify it, and all. If the reviewer did not understand it, readers might not either. Okay. And the effort required to defend this point is much more than the effort required to change that particular point. So always change parts which have been mentioned by multiple reviewers. I think this is the most important point here. You may get different perspective on different reviewers, 3 or 5, as Dr. Vanati just mentioned. So if 2 or more reviewers making the same point, it makes sense. Just change it or delete it because the reader is also going to find out the same point. Right? Repeated comments also stand out to the editor. Okay. So again, effort required is much more to defend that point. Right. So revisiting the paper, change categorize as Ashish mentioned, easy and difficult. But do the difficult changes first. Sometimes you may realize the easy changes can be just eliminated. This is a very important point which did not come out in the conversation. Sometimes you may have one reviewer saying a certain thing. You may have second reviewer saying an exactly opposite thing. Do not use it to advantage. Okay, here. Do not pit them against one another. Let the editor decide what is right or wrong. You follow one person, whichever suits you feel that, okay, this is the point which is I am making is also at least accepted by this one person or two individuals. That means I may not be completely wrong here. Okay, let the editor decide it. But do not write that this reviewer A said this, B said this. I don't know what is happening. Those kind of answers are not good. Even if the reviewer is wrong, it does not mean you are right. This is again a very important point to understand that. Sometimes reviewer may feel that may go overboard. If it's a young reviewer, may not have done the literature review. It doesn't mean that you are also right if the reviewer is wrong. Okay. What if all of this does not work? Right? You've done all these things, still it's not getting accepted, and you're frustrated. You're like, what do I do with this paper now? Target another journal. That means this journal is not suitable for you. Okay. If the fit isn't right, choose journal with a better match for your research. Consider journals with different audiences or focuses. Don't aim lower immediately. Sometimes lateral moves are more appropriate. Like as you mentioned, say ophthalmology. Okay, ophthalmology retina. You can go to AGO. You can go to BMJ or BGO, right? That way. Okay, so after rejection from a high impact journal focusing on surgical innovations, a paper on ROP was submitted to a much more focused pediatric ophthalmology. So we realized that we have to change this journal. We cannot send it to a comprehensive journal or a general ophthalmology journal. We had to send it to, say, a JAPOS kind of journal to get it accepted. So persistence is key here. Many high impact papers face multiple rejections. Keep refining the manuscript based on feedback and resubmitting. Celebrate your small wins, with such as constructive feedback or positive revisions. Final thoughts, every rejection is an opportunity for growth. Stay focused, keep refining, and you will turn rejection into success. Thank you so much.
Thank you, Dr. Bhavik. I think Now it's damage control and beyond. Now, once you get the rejection and still, persistence is the key, is a very important take-home message.
Yeah.
And thank you so much for the comprehensive coverage of all aspects of how to deal with rejection of our manuscript. So I think that was the last talk for today, and we have a flurry of questions in our chat box. I can see the chat box filled with a variety of questions. Should we start from the last, or shall we go with the last one that is completed?
I think we have to start from the Sonali Mehta. Dr.
Yes.
Sonali Mehta.
So Dr. Sonali Mehta has asked this question, open to Vanati Madam and all the speakers. Is it necessary to include the reviewer's comments and replies while resubmitting it to a different journal? Vanati Ma'am, your
Yeah.
opinion.
See, even IJO opines that in your cover letter, you can mention that this was submitted earlier and was not accepted or did not find a place in this particular journal because of these shortcomings, and these have been appropriately addressed. But I don't think that this might go down nicely with the editorial board all the time. So if you've corrected the shortcomings several times, for example, I've submitted something in Konya. It's happened with me, and I found this was it was a perfect write-up. But then I would find the reviewers really given some constructive comments, and which have made me look at my own writing with a new light and with a new light and with a new perspective. And I know now that, if I redo my manuscript addressing these concerns, this is an absolutely new paper then. And I would choose not to, reveal anything else to them, and I would submit it to a different journal. If, for example, I'm submitting to the same journal and I would want the editor to reconsider, then I would put it up saying that these were the concerns and I have addressed this appropriately, and I feel now that this is apt for consideration. I would write it more politely that I would really like you to reconsider or relook at my manuscript for further review and see if it is acceptable for your publication in your esteemed journal. So the way you write your cover letter is a really important factor, because that's the first point of contact which you as an author is having with the editorial team here. And if that's going to be annoying, then it's something like, you've lost your one of the most important chances to walk through the portal of that particular journal.
I think the follow-up question, Madam, is also pertaining to that. When you have changed your methodology according to the reviewer's suggestions, do we again start over with a new ethics approval, or how do we go about?
Can I ask a question which is in line with the first question?
Yes, sir. Yes, sir. Please go ahead.
So what Dr. Vanati explained, that it is a double-edged sword. I wanted to ask, they also mention about whether it was presented at a conference. You think mentioning that also helps?
I mean, there's no harm in mentioning that the conference in which you have presented. I mean, it always says that this was because a free paper acceptance, you would know, in a Vitrio Retino conference, which is a niche closed conference, and it is something very prestigious. And not all papers would get a free paper acceptance. For example, even if we present in World Cornea Congress, or, I'm taking the example of cornea because I'm a corneal surgeon. Yeah. So it's not all papers would get even a poster podium or a poster presentation in a niche specialty conference. So, which means that it has reached a selection level, speaks that this is a particularly important paper. But again, I think all of you would also agree, at least in Indian or in state societies, it's not that all reviewers who review conference presentations are really, are up to the are able to really review it with a particular level or standard here. So arguing that, I got a best of paper session in AIOs really doesn't mean that it is a creditable. You might still have got it, might still have been a good study, but then it also depends on how you're able to translate it into manuscript writing. That is what is going to convince. And speaking over a podium or a free paper for 4 minutes is really, that's 4 minutes is the only time the reviewers are going to assess what you're presenting. But when you write it down, as a reviewer, I can read the paper for even 3 hours and find out so many other critical comments in a point. So you'll have to understand that these two are two different aspects here, but there is no harm in mentioning that this was, and in fact, most journals do want you to mention, and I think ASCRS and all, at least ophthalmology has the first right of refusal. If you are submitting presenting a free paper in ophthalmology, you're supposed to send your manuscript to ophthalmology first, and they have the first right of refusal. And once they refuse is when you can move your free paper out into other journals. Most conferences don't have it, but some of the American conferences do have this policy.
Thank you, ma'am. And your thoughts on the getting another institutional ethics committee approval once again if the reviewer wants you to change the methodology, is that compulsory?
You cannot change the methodology after you've done your study. Either then you have to do a new studies. For example, let's see, I'm looking at using, I'm going to give you, this is a real-time example. I'm using a topical posaconazole in fungal keratitis. So when we framed that study, we could not frame it as an RCT. If I put it as an RCT, then it becomes a pilot RCT. And there's nothing like a pilot RCT. I can only say a pilot comparative trial of posaconazole vis-a-vis the conventional therapy. But I know even if my methodology is correct in this, the reviewers will not pass it through, because then there is no case series or there is nothing in peer review literature which establishes this as an effective therapy in human subjects. Or I also need a bioavailability study. Or there is no other retrospective case series which is talking about efficacy. So how can I compare it to gold standard in an RCT trial? And if the reviewers raise this point, then it's a valid objection. So first, I'll probably have to report so we modified and we were clever with our methodology. So when we did plan the study, we planned it at role of topical posaconazole in refractory or non-healing fungal keratitis. And where we showed that it is performing comparable to the conventional therapy in non-healing keratitis, which means it's working. And now I can go ahead and do an RCT with my own institute ethics committee, because I know my ethics committee will raise this objection. So this is what you learn over a point of time when you're planning studies, and this comes with experience, and that's why senior people in your team will really be able to help you and handhold you and guide you during the planning process.
Thank you, ma'am. Thank you so much. I think this again highlights the fact that 70 to 80% of your study is done when you draft your proposal and your study methodology, and only 20%.
You have to foresee a lot of things when you are doing planning. It might look very simple, but it is not that simple. And I still feel a lot of critical questioning needs to be asked when the protocol is being presented, and not in our center and RP center, we have a separate protocol presentation with all the MD students when they sit in their first year, when they're presenting. And then we have a final presentation when their thesis is done. So most of us are told, don't ask questions when the thesis is being presented, because you failed asking these questions when the protocol was being done. And that's a learning point for us, because we also learn how to do it. And I think that's how we evolved as being teachers and mentors and guides.
Definitely, ma'am. Definitely. Thank you. Thank you so much, ma'am.
There's one more that is left. Ma'am, can we send the article to the same journal after rejection? One of our hot seat participants wanted to know that.
See, you are free to send the article, and then, as I said, mention in your letter that that these were the concerns raised, and several times. Please remember, the editorial team will remember your article, or at least I do read everything. First, I do read everything before I assign it, and there is no benominy who works on behalf of me. I do not know how other editorial teams worked or work, but I do look at everything, and I have put in my team for, that's how IJO works. And I have a team which looks at retina, medical retina, surgical retina, medical cornea, surgical cornea. And I, by and large, refrain from reviewing everything, because I can see the authors of the journals. So I only come in to review this once I have the comments with me, or my critical expertise is required to evaluate a particular article, or if there's an overflow in terms of refractive cornea, cataract, when the team is already filled, then I also step in to do a review work here. So that's how this particular thing works here. And once you are, you're rejecting, it's rejected, and when it comes back to you, and it normally would come back to you because the author is so anxious, he would send it to you within probably a month's time max, because they know this is a journal which gives him the best chance for acceptance. And many a time I do remember why this was rejected. And many a time it would probably go back, even if I forget, it would go back to the same section editor. And the section editor, if it's a retina article, will obviously remember it much more than me. If it's a cognac cataract refractive, I would definitely remember it more than any other person. So if I do find that the revisions are valid enough for accepted to be reconsidered, then I would put it, but again, I would put it into a review again. And again, the decision is going to be based on what the reviewers are also suggesting. Of course, the editor-in-chief has the authority to overrule or to acknowledge what the reviewers are saying, but that is largely going to be dictated by the strength of the manuscript.
Ma'am, do you recommend that we should mention in the cover letter that we are resubmitting it after
Yes.
revision?
Several times, most of these authors do get back to me, have a discussion with me. I do frankly share with them the comments which have come, though I do not share the identity of the reviewers, but I do share the comments. And most of the times, if you see in the last year, I do share a lot of the detailed comments. And as Dr. Bhavik rightly said, this is not to criticize the authors, but it's to help the authors to learn that what was the shortcoming in their thing and how they can better it, even if they're sending it to another journal. The same happens to me, even if I submitted one recently to Cornea, and the comments were so constructive, and I'm so happy they shared it with me, because that helped me to evolve into a better researcher. So that's how I look at it, and I don't look at it as a negative, but you look at it with a lot of positive spirit, and that will really help you. And as you say, you could always move to lateral journals here. Again, Dr. Bhavik rightly pointed out, you don't need to step down to a lower journal. But the only thing you'll have to remember is, suppose I submitted for, say, ophthalmology and it was rejected, then submitting it again to IJO or to Cornea would again probably get a rejection, because the reviewing team might overlap for these journals being from the same subcontinent. So then it would be prudent to submit it to British Journal of Ophthalmology or to submit to the Australian subcontinent, because then you would know that your team of reviewers would probably be different. So that's a strategic way of approaching your rejection.
Ma'am, thank you, ma'am, for your time. The session success shows in the amount of questions that we are getting in the chat box. It's been a while since we have had this kind of chat box bombing, ma'am. I hope a couple of minutes more of your time. Dr. Akash has posted another question. Is it acceptable practice to directly reach out to the editor-in-chief regarding, when there's an ethical question again, or rather a conflict of interest question? Yes, ma'am.
Sorry, I do not understand what he really wants to know. Okay, is it acceptable industry practice to directly reach out to the author regarding a possible publication? Won't it raise a conflict of interest? Sadly, many Indian authors do it. And this is more so for industry-sponsored research. And I'm sure the industry personnel do not reach out until and unless some of the authors have guided them to do it. But I still follow a very strict ethical policy in terms of in terms of assessing the articles. I try to be I am as unbiased as I can be, and this is even for authors from my own institute. And I do not review, and I do not send it for review to any of our own people once it is coming from us. So I frankly do go by the expertise of the reviewing committee, which is looking at the editors who are editorial board people, the assistant associate editors who are looking at it. And I think I do not let the influence of anybody speaking to me really influence my decision. I might not go down well in their books, but I think I'm grateful that that Indian ophthalmologists have placed me on a portal with the trust that I would be doing this job unbiased and to the best of my abilities to raise Indian standards in the world academics. And I will do the best to the as far as long as I'm here, and I will not allow anything to influence that decision making.
Thank you,
Thank you
ma'am.
so much.
Ma'am, can we take some more questions, or shall we ask them to post it in our WhatsApp group? Questions just keep coming, ma'am.
Another maybe till 9, 10 or so.
Okay, ma'am.
Yeah.
Another question is by Dr. Shilpa. So after submitting to an international journal, if it is taking 5 to 6 months to respond, even after the revisions are submitted, in that case, should we wait for the response or consider submitting it to a different journal?
Okay. See, once it is submitted to a particular journal, you
To
cannot
withdraw it.
submit it to another journal that is not compliant with publication ethics. So any article cannot be under simultaneous review with 2 particular journals here. So if you want to submit it, you're free to, submit it to another journal only after withdrawing it, and your withdrawal has been approved by the editor-in-chief of the journal where it was being considered.
I think that's it, ma'am.
Yeah.
Thank you, ma'am. This has been one of the
If you would allow me.
most dynamic webinars ever, at least in our capsules of IJO Livewire. I think the audience questions are already done, and thanks to all the hot seat participants to really keep the discussions very engaging and very lively. And thank you, Vanati ma'am, for.
Can we ask one last question, please, Dr.
Okay.
Prasanna? I think
Yeah.
I'll re-ask the question Dr. Bhavik had already asked in the chat box earlier. Ma'am, what is the number of articles which IJO receives in a month? Like, I think even I wanted to know that.
300.
300. Right. So what would be the average time for a successful publishing in IJO? Like if it goes through all the peer review process.
See, if I find something is really novel, something is new, and that needs to see the light of the day sooner, then we expedite.
Okay.
So those are expedited publications. If it's something really absolute, it's path-breaking, because then it's also going to score a lot in terms of impact factor for IJO. It's going to be stated. But then otherwise, a normal review, see, first, the flow of the process is that once it's submitted, and there is a period of 1 week. So you would see there's a last date by which the editor-in-chief looks at it, and the editor-in-chief finds this is good enough and can be processed. Then it moves to the associate editors, or the editor-in-chief. I myself put it into review after a technical check. In IJO, the technical check is also done by ophthalmologists. It's not done by the publishing firm. So it then gets assigned to the assistant editors for the technical check. And if they find there are some shortcomings, the references are not in order, the way they've written the methodology is inappropriate, are there several other faults, then the assistant editors, again, they have a period of about a week or so, or about less than 10 days with them. So within that period, they will review it, they will look at it and send it back to the authors. And it depends on when the authors are sending it back to them. So again, this process, depending upon the number of time, and several times, I think the authors can avoid this step if they look at all the submission guidelines carefully and conform to it. Several times they do not do it, and they just write it up without that thing. And then there is a needless wastage of time in this. If this is cleared immediately, and then it goes to the associate editor, the section editors who assign for review, depending upon the strength of the subject, they would choose the number of reviewers, or they could review for them by themselves. If it's a small case report, if it's a photo essay, if it's a video, then the in-house team itself would review. Otherwise, they would take at least 2 external reviewers and 2 internal reviewers from the review board itself here. And then it is put into review. All reviewers are given about 10 to 14 days, and sometimes they do not comply, and then the period is extended. So for example, I've given the article to A, B, and C. C has replied, but A and B have not replied, and I know they are people who are strong, who are really valid strengths in that particular subject, and I would want their opinion. I would keep extending by a week every time. And again, I think nobody wastes their time. It's because they're also held up. So roughly 6 weeks for your about 4 to 6 weeks for the reviewing. When it gets back to the author, that would take another 2 weeks. Gets back to the reviewer for re-review, that will be another 2 to 3 weeks. Then gets back seen by the EIC before they clear it up. And then it comes back to the author. Then if a payment is required for photo processing, that's particularly done. And once the author proofs are completed, it takes up to 6 weeks by the time it goes into AOP. So that's how it works.
Thank you so much, ma'am. Thank you.
Thank you, ma'am. We have come to the last part. We'd like to thank simultaneously along with the certificate distribution. So thank you to our chief guest, Vanati ma'am, for guiding YOSI and all young ophthalmologists. Thank you for taking your time, ma'am, for answering each and every question in the chat box very patiently and sharing your pearls of wisdom for novice as well as the upcoming young ophthalmologists to kickstart or rather to model and modify their journey in the publications. Thank you for it, ma'am. Thank you for your time and as well as your wisdom. I would also like to thank Ayushi, who is part of the convening team, along with Anujit. Anujit was unfortunately not able to join us, but taking care of all the other logistics, Dr. Ayushi and Dr. Anujit. Our dynamic speakers, the trifecta, Dr. Nawazish Sheikh, for talking on how to write a paper. And I always feel amazed by the amount of video-based learning that she always incorporates, even if it's a dry topic like a publication. Dr. Ashish Markan for responding to rejection positively with very live examples, as well as how to construct the revisions. And of course, the last speaker, but not the least, Dr. Bhavik sir, again for throwing a lot of wisdom on how to build upon rejection and how to go ahead and convert it into an acceptance, which is most important, not to get bogged down by rejection, but rather approach it more positively and constructively. And a big kudos to the hot seat participants for making this very interesting. We had the section called the hot seat section, which was created by Dr. Sonal Kalia, who was also our immediate past president, as well as the journal club in charge. So it really kicked up today. Dr. Akash Chaudhary, Dr. Arshi Singh, Dr. Gaurav Gupta, Dr. Kaveri Birla, Dr. Mozam Parvez, Priyansh Agarwal, Dr. Sahil Bandari, Dr. Samhita, Dr. Shilpa Ghosh, Dr. Sonali. Thank you all 10 hot seat participants for really keeping the speakers as well as the moderators, co-moderators. And of course, ma'am was very patient enough to answer each of your questions. And we'll make sure we compile all the questions and put it in the group as well, so that it will serve as a good teaching module and resources with links that has been shared by one of our speakers, Dr. Nawazish. Again, a big round of applause to our Dr. Niranjan, who helped me, along with myself, he helped me with getting the slides and the logistics of this meeting ready. Thank you, Niranjan. And of course, I am part of the Journal Club team. Thankful to the whole.
Thank you, Prasanna sir, for being the leading light, without whose support this would not have been possible.
Thank you, ma'am, and all the speakers, and especially Prasanna sir. Had been a fun discussion and a very thorough discussion. It was fun. Thank you so much.
Before we wind up, a closing statement from ma'am. After that, we will go out of live for our group photograph. A closing statement to Vanati ma'am.
Yeah. Thank you so much. And I would love to see at least, 50% of these people coming into the IJO portal to take it forward during your times.
Thank you. Thank you, ma'am.
Thank you, ma'am.
Thank you once again, ma'am. Thank you.
Thank you, ma'am.
Manjula ma'am, can we go off live?
Thank you so much. Thank you.
Respected attendees, can you all switch on your camera for the photograph, our mandatory YOSI photograph? One